Okay, hello everyone, and many thanks for joining this fourth webinar. So we're just getting just a couple of things set up. So hopefully everyone joining today knows the topic in advance, but we're going to discuss responding to mental health and isolation during the COVID-19 pandemic. And the session today will be chaired by myself and Austin Smith. And I'm delighted to welcome our speakers today. So a range of speakers from around Scotland. So we are very grateful to, first of all, Ellie Frankish will be speaking from NHS Lothian Substance Misuse Service, and she's one of the specialist occupational therapists there. And then we'll have a session with Jennifer Lang, who is a service manager for Turning Point Scotland at the North Ayrshire Prevention, Early Intervention and Recovery Service. And then finally, we'll be finishing off with our third speaker, John McCormick from Recovery and Training Consultancy, who you may also know for his work with Scottish Recovery Network formerly. So three different speakers today, and then we'll be followed with a question and answer session as well. So please, we invite people to send in questions as they come up throughout today. Sometimes what happens with webinars is we get a lot of questions right at the end, and it can be difficult just getting through all of them. So if people do have any burning questions either now or certainly as the speakers come in, please do send them in, and we'll try and get through as many as possible. And we'll also try and get some answered after the session if we don't get to them all as well. So thanks again for everyone joining. Really, I guess we just wanted to say partly why we chose this topic was, you know, in supporting people who use substances, we're seeing really a big range of impact on mental health and isolation. So certainly in terms of my own clinical practice in Glasgow, what I've been finding is people will talk about really quite a mixed picture in services. Some people talking about challenges in accessing mental health services, and some people actually saying that the new ways of working in the pandemic, so things like online support and phone support, that's actually made it easier to access. So I guess we're going to try and cover some of these themes, talk about good practice, and also talk about, you know, elements such as self-care and mutual aid as well, so that we can share these with our clients during this difficult time. So I guess we recognise that people's substance use can be affected in many different ways when they are more isolated due to self-isolation. So for some people, their substance use may escalate or change. They might be using a range of different substances. For other people, they might be in recovery and just kind of struggling to manage maintaining recovery during this time as well. So all of these things will come up for clients, and hopefully today we'll be sharing that good practice. So I'm first of all going to hand over to Ellie Frankish from NHS Lothian Substance Misuse Service, and she's going to be giving us a 10-minute presentation, and like I say, we'll be able to ask her questions at the end of the session as well. So thank you everyone for listening.
Hello. Hi, is that okay? Can you hear me all right? Hopefully you can. So I've put together some slides, and I'm just going to kind of talk through a little bit about what we're doing in our team in Southwest Edinburgh in a substance misuse service that I work in. So I'm a specialist occupational therapist in the team, but it is very much a kind of whole team effort, and we've all just been pulling together. So I'm kind of speaking on behalf of my colleagues as well from other disciplines here. Could we get the next slide? Okay, so who we are is we're a recovery hub. So in Edinburgh, we've got 4 locality hubs across the city. We're based in Wester Hailes, which is a fairly deprived area of the city, but we cover quite a large geographical patch. We're a partnership model in the hub. So we're an NHS team, a specialist social work team, and Change Grow Live, which is our third sector recovery partners. And in our own NHS team, we're made up of mainly mental health nurses, some of whom are independent prescribers, a consultant, a registrar, myself as an occupational therapist, a clinical psychologist, and a clinical support worker, which is a new role with a remit kind of around supporting physical health primarily, and an admin support team as well. So we're actually pretty lucky in the sense that we're well staffed. We've got a good multidisciplinary team. We've also got the advantage that we've been co-located from the start in a kind of real physical hub, whereas other services across the city haven't had that advantage. So the kind of joint working aspect hasn't always been as easy to develop as it has for us, but we've managed to put together a really collaborative team here in Wester Hailes. Next slide, please. So our model of care that we've developed is, like I said, we're a very integrated team. We're trauma informed and psychologically informed in the way we offer our services. So we recognise the incredibly high rate of complex trauma, of mental health needs, of social deprivation, as well as physical comorbidities amongst our client group. We've tried really hard to develop a holistic approach to care. So that involves wraparound services. So we're doing physical health clinics like sexual health, EBV testing and treatment, physical health monitoring, as well as kind of focusing on harder to engage clients who maybe are living a bit more chaotic lives or struggle to engage in kind of conventional treatment approaches. So things like low threshold clinics where people can drop in and they can be seen and access all their health care in one session, really. We also offer a number of groups, so that's like physical activity gym groups, we've done cooking, skills groups, and kind of signposting and drop-in sessions, which are just a low threshold, sort of people wanting to find out a bit more about what's available. So I guess looking at that, you'd think, how would you deliver that during COVID and everyone isolating? It seemed like quite a big ask, really. So I've tried to summarise what our response has been overall, then I'll go into a bit more detail as I go on. So one of the first things we did was to kind of create individual risk profiles for our clients. So this was done by key workers looking at their caseloads, and we were considering risks in terms of COVID risk, might be physical comorbidities, they might be shielding, or they might not be sort of officially shielding, but they might be vulnerable for other reasons. Respiratory conditions or other kind of factors like that. But then there's also mental health risks, social risks, like who do they live with, whether there's a background of domestic abuse, you know, so kind of a really wide scope look at the risks that were involved. We've tried really, really hard to keep in touch. That's been the kind of core of it. So making sure that the communication channels are open, and that's in a way that works for the client. So it's telephone, text, they're being given options of how they choose to do that. We've used a really flexible approach as a team, so our roles and things have kind of all changed a bit. We've just pulled together and done what needed to be done, especially at the beginning when we were kind of trying to figure out how we were going to manage it. We focused on basic needs a lot. So a lot of what people have been presenting with is challenges around basic healthcare, about how they access food, basic supplies, picking up prescriptions. So we've had to kind of go into really basic needs, including kind of basic self-care. So I have clients that I work with who can't cook a meal, who've never cooked a meal, and they'll eat out on the run, they'll eat sandwiches or pies or whatever. And now they're finding this a really challenging time. So even kind of simple meal preparation and things like that, focusing on health and well-being. And also one of the other sort of first things we did was create a resource, because we were finding lots of information was being fired at us from the community about we're offering this service is changing to do a telephone support, or we're delivering food parcels. So we put that all together into one shared file so we could all access how to refer for food, how to, you know, refer for befriending, telephone support and things like that. So we've kept that kind of really strong from the start, and we've tried to reach out to our community partners as well and find out what they are offering and how we can keep our links going. Next slide, please. So I guess I was kind of thinking about what the risks are to people during this time, and I think in some ways when you look at it, there's almost a kind of perfect storm of risk factors which could go really badly wrong for the people that we work with. So it is a time of kind of really significant risk that we really can do a lot to help mitigate. There's the social isolation and all the kind of knock-on effect of that. There's the potential disruption to treatment services in terms of just how they physically changed, and we're not seeing people face to face very much at all. Staff absence and things like that. We don't know so much. I mean, we know a little bit, but there's obviously impact on substance use, how that's supplied. You know, we know that there's been shortages, which means people might be substituting for different kinds of drugs, and there's obviously risks inherent in that. People's patterns of substance use may be changing. You know, for example, people might be using more by themselves where they would have used with a group of people before. You know, so there's all of that to consider. We've also, in order to protect people, you know, legitimately, we've had to reduce their pharmacy pickups. You know, people who might have been on daily supervised, being reviewed, and perhaps drop down to maybe 3 times a week pickup. You know, or even for people who are relatively stable, it might be even less frequent pickup than that. So people who are being given large amounts of medication to take home. You know, there might be reduced access to harm reduction supplies. And, you know, we know that our patients are already high risk with things like their physical comorbidities. So they're higher risk in terms of actually COVID itself. So in terms of impact, you've got all of these other things on the right-hand side. You've got an increased risk of overdose, of relapse, and a difficulty in kind of targeting people who are maybe teetering on the brink of a relapse, or who, you know, have relapsed, but in the past we might have been able to meet them and intervene a bit more robustly to kind of help them to put that back on track. We've got lots of practical problems for people who are vulnerable or shielding or can't get to the pharmacy, lots of unmet physical needs, and huge vulnerability around, you know, as we all know, domestic abuse, and around potential for exploitation, and you know, vulnerability to self-neglect and poor self-care. That's meant to say, I can't see that very clearly, but it's meant to say mental health impact there on the right-hand side. So this is just our kind of observations so far. It's a bit of a straw poll with my colleagues over the last week to see what they've noticed with their clients, and some of the ones I've been working with myself. So we've seen a real loss of the usual coping strategies and all the things that we've reinforced for ages with people about creating routines, going out, making physical connections with their community, with their friends, with other people in recovery, you know, attending meetings, all of these things that we've been encouraging people with for years sometimes, and have kept them afloat, have been sort of pulled away from them. So that's been a huge impact. There's lots of anxiety, some people who already had high levels of anxiety, and, you know, other people who the COVID situation has heightened their anxiety. And also people with anxiety have got a particular challenge, I think, because exposure is the biggest treatment for anxiety that we use. So it is all about setting small goals, about putting yourself in situations, and about going out. And people who can't do that, finding their anxiety is becoming quite overwhelming at times. There's an increased relapse risk. We've noticed it in some people who have relapsed, and we think we might have been able to kind of help them prevent it in the past. It's hard to say, but that we have been aware of that. Some people on their own are very lonely, and finding that a real struggle. And then I think there's a bit about skills. So a lot of people don't have very good skills in self-care and self-regulation and emotional regulation particularly. And I think for all of us, we've found that we will have had ups and downs. I've had bad days with this as well as okay days and good days. But I can sort of regulate that, and I can put that in perspective. But for somebody who hasn't got those skills, that can become quite overwhelming, and that could be a trigger for relapse, for self-harm, you know, for a kind of bit of a mental health spiral to start. And then other skills like problem-solving skills, people don't always have these, and they've relied on workers to help them figure out what to do in different situations, and that's been difficult for them to access support sometimes. And then lastly, this kind of whole lack of structure. How do I organise my time when I haven't got my meetings and my groups? How do I create a kind of meaningful pattern to my day? And what's the impact of not doing that? And oftentimes it's this kind of negative spiral of mood becoming low, motivation dipping, and then that kind of is self-perpetuating for a lot of folk. Okay, next slide. That was quite gloomy, but there have been, I think somebody mentioned this earlier, some unexpected benefits. I was listening to University College London are doing a survey about COVID, and they found some such positive results for folk. So we found that about half of our caseload are quite coping fairly well, have discovered some kind of resilience. They've been a bit more able to try the self-help techniques that we've been sort of encouraging them to use for ages. Some people have rediscovered previous interests or started trying new things like maybe baking or gardening or reading or whatever it might be. And I think there's been a kind of collective relationship building for some people. So we have all been in this together, workers and clients. So I think for some people who've always felt a bit on the margins and a bit excluded, that has helped them to feel connected to something in a way. And some workers have reported that that's created a more equal relationship, and people are a bit more able to be open and honest about that. It's been an opportunity for reflection. And in terms of routines, this reduction of focus on pharmacy, going to the pharmacy every day or whatever, how many times a week, has actually created a bit of a sense of control, and for some people a bit less conflict, because there's been less exposure to other people and kind of potential risks around that. Next slide. I think I'm going on too long, so I'll skip through these, but you could maybe get the slides. These were just a bit of kind of media information about the impact that people were describing. I like the stuff about physical connectedness and how it isn't the same to be speaking on Zoom or on the phone, and the hugs that happen in meetings and things like this, and the service that happens, and the kind of having to be there and having to do a job, and how important that's been for people's recovery. Okay, so we'll move on to just a kind of a wee summary of our main interventions, what we've done. So down the left, some of the things we've done with clients. We've increased our phone contact. We've given them the chance to phone and text whenever they feel they need to, and we've also been creating regular phone and text appointments. We've given phones to people who didn't have one, so some of our clients didn't have access to a phone, so we've managed to get funding to provide them with one, just a basic pay-as-you-go phone, so that we can check in on them, make sure they're safe and well. We've done a lot of kind of skills work, basic mental health, self-care, activity scheduling, a lot of stuff around self-soothing, relaxation and grounding techniques, and then looking at what enjoyable activities there are for folk, and working through things like problem-solving skills with them, rather than always kind of rushing in to solve their problems and fix it for them, kind of talking it through with them a bit more, and how are you going to resolve that yourself. We've had a few technology wins, so we've now been able to set up send-only mailboxes so that we can email things like self-help resources out to our clients, which in the past we weren't allowed to do. And we've been set up with video appointments through Near Me and Attend Anywhere. And we've been directing people to all of the useful apps and resources that are out there, things like Feeling Good that people can download on their own phone. And then to the right, there's some of the staff interventions. So we've done things like split our teams, so we're half home and half in the office, and we have a buddy system. We have a psychologist who's able to provide staff support, and we have a daily huddle, and we allocate tasks so everybody's clear about who's doing what, and we sort of share all the responsibilities across the whole team. There's just a little bit more over the page, sorry.
Thanks, Ellie.
Can I keep going? Nearly finished.
Yeah, thank you.
Okay. We've got loads of really cool community groups here, so we've done lots of linking with them, I think I mentioned that, and directing people to things like online meetings and helplines and things. We have been working with a partner to provide art packs which we can deliver to people to use at home, and we're kind of working on widening that out to produce things like self-care packs, activity-based packs. There's lots there I could talk about at the end about prescribing arrangements. We've been doing deliveries out to pharmacies and out to people who are shielding, as well as delivering naloxone and delivering safe injecting equipment via our CGL colleagues. We've got one thing to mention, we've got lots of treats in the office, lots of sweeties, and that's been keeping us going. But that's the main points for that one. And then I think There's
wonderful.
just a list of who's around in the community for us. Thank you.
Fantastic.
Sorry, that was a bit long.
No, thank you so much, and we'll certainly be able to share slides with people as well. So what I'll do is I'll hand straight over to Jennifer Lang, if that's okay, and we'll come back for questions at the end. So Jennifer from Turning Point Scotland, Ayrshire Peer Service.
Thanks, Katie. Good afternoon, everyone. I would like to thank the SDF for continuing to keep us all informed during this time, as well as inviting me along to speak today. So as Katie mentioned, my name is Jennifer Lang. I am the Service Manager for Turning Point Scotland Service in North Ayrshire. We are the Prevention, Early Intervention and Recovery Service. We're a relatively new service within North Ayrshire. We only started in August last year. So we were very much still finding our feet in the addiction landscape of the local authority. We hadn't had a third sector service delivering support to individuals using substances for a number of years, so we were definitely welcomed with open arms. My background is predominantly working in justice, so I just want to highlight that addiction, offending behaviour and mental health conditions are all very much intertwined. Therefore, we can't and shouldn't ever look at one in isolation. That's what we've been trying to avoid while we have been working within North Ayrshire. We prefer to focus a great deal on the health and well-being of the people we support, rather than solely the addiction that's brought them to the service. With this in mind, we developed the service to be very inclusive and holistic, which has definitely stood us in good stead during the situation we currently find ourselves in. As most of you will know, we already work with individuals who are already marginalised and socially isolated, whether that be for their addiction, their mental health conditions, or their previous criminal history. Therefore, this situation has compounded the issues that this group already face, which in turn possibly has already and may continue to exacerbate their use of substances or alcohol, as well as the decline in their mental health conditions, whether these are diagnosed or undiagnosed. I suppose thinking about the immediate concerns that we have for people within North Ayrshire is that reluctance to engage in primary healthcare services. This could be for a number of reasons. Some include the reluctance to leave the house and fear of contracting the virus, not really knowing who to contact, what services are even open, or what ones will let them through the door, as well as the age-old issue that our service users always face of that fear that they only appear to be chasing a script. This is leading to individuals neglecting their mental health and their physical health, which is already a concern for the people we work with, but this situation is only leading us further down that path. There is a flip side to it though. We've found that service users are taking a great deal more responsibility for their own health and well-being. They recognise the strength and determination they have within themselves to keep themselves safe. They've also got a greater understanding of how and where to engage in services. Another positive, I suppose, of the situation we're in lockdown is that the structure that people are being encouraged to have, which focuses solely on the very basics of mental and physical well-being. In recovery, we tend to focus a great deal on human interaction, attending groups, meetings, having routine and structure to your day, which mainly involves leaving home, which we can't do just now. So for me, recovery is all about self-care, and being able to enjoy your own company is pivotal in achieving that, as well as vital and long-lasting recovery. This situation is definitely asking us all to re-engage with ourselves. To overcome some of the barriers in our service, we have had to adjust like many others and find different ways of working. Prior to closing our office at the end of March, the staff focused solely on developing activity packs for our service users. In these packs, we had short stories, meditation guides, some activities such as adult colouring sheets, crosswords, word searches, some recovery worksheets, as well as links to online meetings. We also set up a Facebook page, which was there for our service users, but is open to everybody struggling with addiction within North Ayrshire. This is mainly a peer support page, although staff will occasionally go on and post some creative writing tasks as well as some guided meditations. Again, we've had to adapt to online meetings. It wasn't an entirely new concept for us. It is something we had been discussing for quite a long period of time. We have 2 islands within our local authority, so we were always trying to find other ways to offer support to individuals that were already socially isolated. However, we had that initial fear of taking that first plunge into the virtual world, although I think it's safe to say we've all overcome that fear and have a newfound confidence. We've had a lot of support from colleagues across the country. Our Aberdeenshire services, as well as our Service User Involvement Group, TPS Connects, have been continually engaging and setting up different online meetings. These include something called What's Up, which was adopted by our TPS Connects colleagues through the citizenship approach. This particularly works great on Zoom. Only one person's allowed to speak at a time, so the host can mute all others, which comes in handy. We also facilitate groups looking at positives and negatives of an individual's week. We have a weekly quiz, a weekend meditation session, and our Aberdeenshire colleagues have recently invited us into their fitness session that they do every Thursday morning. One of my colleagues has even suggested a walking Zoom where individuals can link in with others on virtually on their daily exercise. As a service, we try and avoid focusing on the addiction all the time, especially during this time. We're trying to turn our attention to just keeping people's moods lifted as much as possible. This doesn't take away from the important work that our staff already do. They are continuing to facilitate one-to-one sessions with the people they support, some of whom who have chosen to actually participate in these through video calls as well. These sessions are vital in continuing to work on the goals that the people we support identified when they first came to their service and their initial support plan. Staff have been continuing to talk them through tasks in a day to keep that routine and structure, talking them through their coping skills, as well as being there just for that support for any difficult circumstances that they find themselves in. They've also been making sure that service users have up-to-date contact information for any services if they ever find themselves in crisis. Promoting self-care is absolutely vital during this period of time, and during one-to-one sessions the staff are empowering people to continue with that structure and routine. Getting out of bed, getting dressed and eating properly is a huge achievement for us all during this time. Encouraging individuals in recovery to continue that is a huge part of what we're doing just now. Oh, sorry, I'm clicking out of things here. The staff have also been helping the individuals we support to understand the language that we're so accustomed to using just now, social distancing, isolation, bearing in mind that our service users have been doing this for years, although they've always only ever called it loneliness and isolation. None of this would have been possible without the whole team I have within North Ayrshire. They are a joy to work with every day. They continually think about new ideas and new ways to support our service users. We promote self-care within ourselves. We have daily tea breaks where we all get together on Zoom just to have a chat. We also have a weekly debrief where we all get together and discuss what's went well and what's went not so well within our weeks. We've been very supportive of other services across North Ayrshire as they have been with us. Our local statutory addiction service, NADAS, was vital in supporting us to access PPE to keep our staff safe, and we've been helping them with their medication deliveries as well. And just a plug for the addictions app that we have in North Ayrshire. Ayrshire and Arran team, NHS team have developed that, which has came in very handy during this time. As an organisation, we've also been looking at ways to support our service users. This has included accessing smartphones that we've been able to distribute to service users across North Ayrshire. We've also funded SIM cards as a service with unlimited data to allow our service users to access the wealth of online meetings that are out there. We've been able to do that because of the savings we've had in our budget with staff travel, because we're all working from home. So I think it's clear to see that ourselves and a lot of other services will not go back to the way we worked before, although it is hugely important that we can continue in recovery to have that face-to-face support whether that is in recovery from mental health or addiction. Thanks, Katie.
Great, thanks Jennifer, that's perfect, thanks so much, and it'll be great to hear questions coming in. So yeah, I'll just remind people to send questions in if anything's coming up, just so we can get through them all before the end as much as possible. And I'm now going to hand over to John McCormick, please, if he's ready to talk. Thank you.
Hello. It's all very strange because I'm not sure whether I'm talking to you, but I assume I am. And I'm John McCormack, and my background is in counselling and homelessness and the Rough Sleepers Initiative in Glasgow. And this COVID-19 experience is affecting the whole nation, obviously. And you would think that it was affecting us all equally, but we know now that it's affecting the poor and the excluded and people with underlying health problems. It's not affecting us all equally, but the stress of it is affecting us all to some degree. And obviously, if you've already got addiction, a lot of us would assume that that was an indicator that there might well be past traumas there, and that being isolated at a time like this is one of the worst things that you can actually do for somebody. And cutting off all the social connections is one of the worst things for your mental health and one of the worst things for a background in trauma. So that aspect of it's not good. And I guess that there's a story starting to emerge nationwide and probably worldwide about what exactly happens now with this pandemic, and it's got us all thinking. And the story, I think, is up for grabs. And you know, one of the aspects of counselling, for example, is to try to normalise things for people. So people might say, I'm feeling incredible anxiety and I'm feeling incredible fear just now. And we might say in response to that, well, yes, it's flipping terrifying what's going on just now. We're in the middle of a pandemic, we're in the middle of the unknown, and none of us have ever experienced this before. And who knows how it's going to all pan out. So yes, you're anxious, I'm anxious, we're all anxious. And I think it fits with the current thinking in relation to trauma and the stuff about adverse childhood experiences that's been around now for a long time. And people are very acquainted with the idea that it's not what's wrong with you, it's what's happened to you that matters. Or also the idea that your current reaction is a sane response to insane circumstances. And you could truly say that just now about the situation we find ourselves in. It is all extraordinary, and we're all reacting in our own particular way. I guess, though, we could look at this story and how it's going to unfold, and maybe even, you know, we're very fond these days of talking about the narrative. We could look at the narrative and what's coming up in the media and what's circulating in the zeitgeist is the idea almost of a post-pandemic crisis or disaster story. And there are headlines in the papers talking about catastrophic mental health crisis. And I've seen COVID-19 pushing America to looming mental health crisis, spikes in mental health problems. And these stories are around, and we've got this, the Lancet Psychiatry reported that people with psychiatric disorders might well experience worsening symptoms, stress levels will increase, all of which is associated with suicide risk. And so you've got this emerging post-pandemic story, which is pathologizing, really. And if we go down that particular road, we end up with much more discussion about mental illness, much more discussion about psychiatric referrals, medication, and citizens become redesignated as patients, and we have to start treating them. I guess a more social model way to look at this would be that it's okay to be scared, and COVID-19 is absolutely terrifying for everyone, whether you've got an addiction or whether you're a middle-class person at home in a nice house, it's still scary. People are actually dying. There's catastrophic things going on in care homes, and our lives have been turned upside down. People's jobs are at risk. And I guess for people who've been through trauma and are currently isolated, it triggers the sort of classic defences of fight, flight and freeze. Fight, flight and freeze are absolutely useless against a virus, and yet that's what's triggered this primal stuff. And we end up with people in denial, and we end up with massive anxiety going on. And it's, in some sense, a fairly pessimistic picture. But as some of our previous speakers have been talking about the positives of this, and one of the things that interests me in trauma therapy and in life in general is the phenomenon of post-traumatic growth, and we might call it post-pandemic growth. And this is starting to emerge into the story of what's happening in the UK. One of the things that I find extraordinary is that we, the public, now can see who the workers we really value are, and we can now literally applaud nurses and shop assistants and doctors and transport workers. We've had a gigantic shift in perspective. We have discovered something that I think is unbelievable, and that is that homelessness and rough sleeping can be solved in one night or 1 week. We had targets in the Rough Sleepers Initiative back in the 90s that we were going to solve homelessness by the year 2020. We did not solve homelessness by the year by the year 2000. We were going to solve it by the year 2000. We did not solve it or get anywhere near it. And then suddenly, in a couple of nights, all rough sleepers are off the street. Unbelievable. And it tells you that there is a magic money tree, and if the political will is there, miracles can happen. And I guess that's the new world we're living in. And so I think the choice is ours. The choice is how we choose to work with this, and how we, perhaps all of us, service users, all of us, are having to embrace vulnerability. We're having to acknowledge that life is fragile and precious. We're having to acknowledge that we live on a knife edge, health-wise, any one of us. And I think coming from that, you begin to see more kindness, you begin to see more compassion, you begin to see more levelling down. I think it was Ellie that mentioned a different relationship between workers and service users, because in some sense we're beginning to see that we're equally fragile in some sense, and that we are equally at risk. And so I guess there's a new sense of priorities and values appearing. The other upside of all this is the gigantic shift towards using Zoom and using technology to have meetings. And we're talking about innovative ways of working. So the Recovery College that I'm involved with in North Ayrshire has got a massive amount of people attending on Zoom. It's doing amazing work. People keep coming back, and one of the aims of that is the democratisation of recovery knowledge and skills. We've got people with addiction issues, we've got trauma issues, you name it, we've got these people coming to these meetings. We're running courses, we're providing recovery education to people, and people are using it. And we've got another project starting up as a pilot in the north of Glasgow that I'm doing in partnership with the Violence Reduction Unit and some other partners. And again, it's going to be community-led, strength-based, and we're looking at delivering online group work for people. And we originally thought that we would wait until lockdown was over and do it face-to-face, but that might take forever. So we're going to start as soon as possible. This is a pilot. So don't ask me any questions about it just now, because it's also providing a bit of research. And as soon as we've got some data, we'll put it out there, and hopefully people can replicate it and roll it out. Assuming it works well. It involves existing community leaders, and it's a kind of asset-based approach. So that, in a nutshell, I think is where things have been going for me and my take on COVID-19.
Thank you, John. That's wonderful. Yeah, great to hear about everyone's experiences as well. So I think we're just going to go straight to questions because we've got loads and loads flying in. So we'll try and use the time as best we can. So I'm going to invite my colleague Austin back in and invite the speakers to come back in so we can see you all. Yeah.
Hi. Yeah, this is my role here is to try and condense a range of questions by theming them and grouping them together. And I suppose one of the things that people are asking about is that legacy question about when this is all over, what bits do we want to keep, what things are actually useful to people, and how do we preserve that instead of just going back to the old ways of working.
Can anyone answer that?
Yeah, if anyone's got a desperate burning wish, go for it.
Yeah, I mean, that question about what happens after all this, I think that's absolutely up for grabs, and it's up to us. We're now in a world of possibilities when you're seeing things happen that you wouldn't have believed happen. I've mentioned homelessness, but you've almost now got a standard living wage being handed out. You've almost got people being subsidised to be at home. This is a whole new world, and I guess it's up to us all to make sure we don't, in a sense, relapse back to the old normal. The new normal's got to be better than the old normal, which, to be honest, wasn't working for a lot of people.
Yeah, I wondered if I could bring you in, Nellie, about, obviously you talked a lot in your presentation about changes to your practice and doing a lot of phone and online work. So I'm curious how that's working for you and how you see that maybe as altering your service.
Yeah, I think it's definitely given us more choice, and that in turn is giving more choice to the people that we work with. So we'll be able to offer different ways of working now to clients. So I think the kind of near me, attend anywhere technology where we can do video calls is something we'll probably keep. And it's not something that everybody's going to be able to do or want to do. But I think maybe for people with children or caring responsibilities, that's going to be a massive bonus that they don't always have to come physically to a clinic setting, and that we can engage in people in more flexible ways. So I think we'll definitely try and keep some of those like technical aspects that we've been forced to kind of develop.
I guess this is maybe for kind of Jennifer and Ellie particularly, just around, I guess, some of the challenges and some of the statutory contact as well, because we had some questions coming in about what I touched on in the introduction about people actually maybe not accessing statutory services as easily. So some challenges, for example, with CPNs and maybe only having really limited contact. So I wondered what your experience is. So maybe Jennifer can say something first of all.
Yeah, I mean, we don't always have a great deal of contact with service users who have that statutory element of support. A lot of the individuals we work with have undiagnosed mental health conditions, so I couldn't really comment on what the engagement's like with statutory mental health services.
I think from my point of view, what I kind of understand from mental health colleagues is that they are doing a lot of telephone contact in the same way as we are, and that they're running essential clinics, so like depot clinics and clozapine clinics and things like this. But yeah, I think it's probably very variable depending on the particular team and the area that they're working in as to how that's affected people. You know, and they've probably got a similar story to us of actually some benefits as well as some, you know, risks that have been heightened by this.
Yeah, so maybe to everyone, like what advice would you give to people that are maybe struggling, where people actually are finding maybe just being in an isolated area or access to services is limited? What would you kind of advise people in your own experiences? So really serious, the panel.
Well, I mean, I guess for me, as a long-term fan of solution-focused work and strength-based work, I guess my question to people, and genuinely is how have you survived these things in the past? And you generally find that people can look back and see, sometimes they've been in prison, or sometimes they've been ill or unwell or in hospital, and they've already survived difficulties. And I guess I'm interested in how they manage to do that and build on what they've already got going for them, rather than assume that this is a brand new experience.
I think as well, the kind of the links with the voluntary and the community sector that sometimes haven't been very well developed between statutory and community services. I think that's something that has come out of this that's really important. So, for example, I've got a patient who's shielding who can't do shopping, and we've linked him up with a community volunteer who's just from a local church. And I think in the past, as a service, we've been quite risk averse about certain things like that. Well, what if XYZ goes wrong? But actually, we've kind of had to embrace that. And there's so much out there in the community that does support resilience and self-coping and assets, you know, community assets that are there for people. So I think that's something that will come from it too.
Yeah, that's certainly reflected in the very narrow medical treatment of people with a drug problem around substitution therapy and so on. That kind of, if I can say, kind of paternalistic kind of approach of making sure that everyone's absolutely safe and doing endless risk assessments and worrying, and then the blanket application of that to people, presuming that everybody in that situation would be exposed to unnecessary risk, has largely gone, simply because we can sustain that kind of attitude. It just didn't become practically possible. So is that true in wider mental health services, that we could have a whole change of culture and a whole change in the relationship between people who are providing services and people using the service?
I think there's probably, that's a journey that we probably need to go on a bit, but I think this has kind of maybe kick-started it a bit, I would say. I think like when we first started kind of trying to figure out as a team how to deal with COVID, the first 2 weeks were all about prescriptions and medications and how do we get everybody the medication, and that was the absolute focus. And now that's kind of settled down. Everybody's focus is much wider, and it's about well-being and the kind of the other things that really matter. So I think it's a process that we have to kind of try and continue with.
Yeah,
really sad to see. Sorry, Katie.
No, please go on, Jen.
It's really sad to see if services do go back to how they ran before. I think this has definitely given us a good example of things that we've probably been talking about for years and years and years of how to do, but as Ellie says, had that fear of actually going and doing them because we're so risk averse. We always talk about how people are difficult to engage, but we've all realised recently that it's not necessarily that. It is our services that are difficult to engage with. And working in North Ayrshire, we have so many rural villages, and this has been great for them because the services have been going to them and they've been phoning them and video calling them rather than them having to spend £10 on a return bus fare to get to the clinic.
So it sounds like there's been some positives for your service, Jennifer, in that we've had to work in a bit of a different way, and I guess that's some of the you know, much talked about strengths of the third sector is that in some ways, because we have less restrictions in the third sector, like we can respond to these things sometimes more quickly, but so refreshing to hear it's kind of across the board with statutory services in some areas as well.
And that's an interesting point about rurality as well, because this has always been something that's been a problem that we just cannot solve because people are in rural areas. But maybe this kind of remote working and people getting used to doing it is actually, I mean, Scotland talks about rurality and remoteness in a kind of bizarre way when you consider how services are delivered in the outback in Australia or whatever. It's normal for everyday schooling and stuff like that. So maybe this is an impetus to put in place the very small resources that are required to support people remotely.
Yeah. I guess one thing that was coming up, because we had a couple of questions in from some of the more rural areas just about, I guess, feedback on things like there was a lot of interest in the recovery packs that you talked about, Jennifer, as well, and just like about links to some of the resources that we're maybe talking about on a national level. How accessible are those for people in more rural locations?
Well, we've obviously, as I mentioned, we have our islands that we serve within North Ayrshire, and it's always been a bit of a concern for services on the mainland about the island not getting the same service as the mainland get. But that's one of the things I'm really hoping changes during this time. We tend to link quite a lot in with other third sector services or other services across the local authority. So I suppose it's just about getting that information out there as widely as you can. We put a lot of information through our ADP, who have got all the contacts also and are able to kind of disseminate that widely. The issue for people at home is if you're sending them worksheets, whether that be through email or they're seeing it on a link, they don't have the facilities to be able to print that off and actually read it, or they don't have the technology to be able to even access it. So that's why we had looked at the smartphones and the SIM cards to try and get them out to people so people can access things like that are really vitally important to their recovery at this time.
Mm-hmm.
Yeah. So it sounded like giving out mobiles and things like that. That's working in a few different services. So it's great to hear that we're seeing room for that in budgets, because that must be completely life changing for a lot of people in this situation.
Our local Fife Women's Aid has managed to get tablets for all of the women in the refuges, and that's just a new development that's become from government funding, and that's come about because of the lockdown. And we know about phrases like digital exclusion. There's never been a time where digital exclusion has meant more to people. To not be connected now online is unimaginable for me. You know, everything happens online now. And to be excluded from that world is well, it's just too much.
Yeah. I was interested as well. We're talking a lot about sort of peer support and mutual aid, and certainly one thing I was aware of in Glasgow was some of the mutual aid groups that have sprang up in response to COVID-19, and there's actually like different channels, certainly in the Glasgow groups, where there's actually a mental health group, and it's dispatched to, you know, different levels of volunteers, but like befriending level volunteers, and then people that are maybe like ourselves, like working in mental health and substance use, that are volunteering some time as well. So there seems to be innovative practice springing up completely outside the services as well. And I guess that leads me on to just sort of talking about like self-care and things like that, because one of the questions we had was around, was there good recommendations that any of the panel might have around things like managing relapse in this time, and maybe escalating substance use, if there is any good sort of resources, self-help, self-care resources that people would recommend?
I took the bull by the horns and made a couple of videos in this living room exactly like this. And I made a couple of videos about self-management, and they're on YouTube, and people are watching them and using them. And I'm going to make more of them, and they're like 5-minute segments and just about individual issues. So one of them was about normalisation of problems, and the other was about the democratisation of recovery knowledge and skills so that people can do self-management, because let's be honest, self-management for lots of reasons is now the way forward. We just can't go to services and get help the way we used to, so we're doing it for ourselves. So I think that's a booming area where people are using more video technology to put the knowledge out there. And the recovery colleges, we've been running it in North Ayrshire for about 5 years now. And at no point did it occur to us to put it onto Zoom and do it online. But it didn't occur to a single person. And so people were coming from, you know, Kilwinning and Ardrossan and Saltcoats and whatnot, and all coming into the one place, and transport was difficult. For some people, the journey was a nightmare. Now we've got all the people in an array there at a big Zoom meeting. And I've managed to, I can't believe it, I've managed to have breakout rooms. So you could ask a question to the group and 4 could go away to, you know, 4 people could go away to a breakout room and have a chat and all over, and then they come back and we discuss the issues about self-management and all that kind of stuff. So I think there's a revolution going on right now, and it's keeping that momentum going, keeping that self-management aspect of it, and it's incredibly empowering.
Yeah, I don't know if Jennifer or Ellie have any thoughts about resources as well, or things that you're using with your clients around self-care or self-management.
There was a lot of links coming out for Breaking Free online, so I think a couple of the staff have been using that. I've been thinking that NHS have been giving out some really good resources as well, and some links they've been handing out. But we, as I said as well, we'll do a weekly meditation session, which was always really well received in the service when we ran it in our office and out in other community centres. People really engaged with that, and we try and facilitate that in a way that it's simple for people to be able to go and practice at home themselves as well.
Okay, I think the other thing is that the question is potentially regarded as self-indulgent or navel-gazing, but it's actually, I suppose, a crucial one is how do staff, how are staff supported in terms of their own mental well-being and empower themselves to help themselves in these kind of extraordinary times.
I'm just going to hand over to Ellie. I think Ellie was saying something, but I think you might be muted,
Sorry.
Ellie. We've lost you for the moment, Ellie. So I'll come back to you. Not to worry, but yeah, I guess just people were also writing in and sharing just like different good practice. So much like we're hearing from John and Jennifer around online Zoom. So there was things like walk-in Zoom that's happening in Inverness and places like that as well. So again, I really liked what Ellie mentioned about just that portal of resources for people. I think Ellie might be back with us.
Am I back on? Can you hear me? I don't know what that was. Yeah, it was a difficult question to answer about resources because there's so many. So I think for us, it's about kind of personalizing them to the individual. So it might be kind of basic breathing techniques, and we've got worksheets and things, but a lot of it is about the telephone follow-up and speaking somebody through the information rather than just sending out links or sheets or whatever that might be quite hard to follow by yourself. So we're kind of really personalizing that, but we have got a big kind of file of lots of really useful resources. So if anyone is interested, I'd be more than happy to kind of share some of those or give you, informational links to them. And I suppose there's that kind of physical health aspect as well, isn't there? So I was thinking about colleagues in one of our local health agencies who are doing their exercise classes online now, and they're doing things like yoga classes online. So I think that kind of physical exercise is a huge part of self-care and self-management as well.
Yeah, great. It would be great to have those links. So I'm just going to put a couple of links up. Sophie's got some slides for us just to kind of mention just some of the wellbeing links that are out there as well. So SAMH obviously have a lot of information on their site about local contacts as well, and they have their information line too. I'll just ask everyone to mute their microphones if possible as well. And Mental Health Foundation have a lot of good self-care advice on there about just managing mental health, and it was great to hear from John about his videos. So maybe I'll be asking all the speakers maybe just to share anything that they would recommend, and we'll circulate that to all the participants today as well. There's things like for cognitive behavioural therapy based stuff, there's Living Life to the Full as well that have a dedicated page around Corona, but also it's like an online course as well, and it's tailored not only for clients but also healthcare workers as well. So just I guess in the spirit of mental well-being, it's about looking after ourselves as well for providing that support. So last link that I'm going to share is that mindfulness practice with one of our SDF colleagues, Adrian Hanna. So a little body scan that maybe people can do after the session, even just to do something good for yourself. So it really just leaves it to myself and Austin just to thank all the panelists for sharing that practice, and also just to say any comments that we didn't get to. The email is there as well, and also just to say that our fifth webinar will focus on HIV amongst people who use drugs during the pandemic as well. And just thank you to all our participants for coming along today. Thanks again for listening.
Thank you.
Thank you.